Here is something your dentist probably hasn't told you because they're too busy treating the damage after it's already happened. Your mouth is home to over 700 species of bacteria right now. As you watch this, most of them are harmless, but the ones that aren't, they don't just destroy your teeth, they enter your bloodstream. Your teeth are not just teeth. They are the front gate of your entire body. Stay with me because what you're about to learn will change how you treat your mouth every single morning, and I've saved the most important thing for the very end, so do not leave early. Let's start with the fundamentals. Care 1 is brushing. Before you say you already do this, let me ask you this. Do you brush for a full 2 minutes? Most people brush for 45 seconds. The American Dental Association recommends brushing for a full 2 minutes, twice daily, with a soft bristled brush, and replacing that brush every 3 to 4 months or sooner if the bristles are frayed. Here's the technique that actually works. Hold your brush at a 45-degree angle to your gums. Use small, gentle circular motions and never scrub back and forth. That sawing motion erodes enamel. Brush every surface, outer, inner, and chewing surfaces. And always brush your tongue, where up to 50% of bad breath-causing bacteria live. If you brush too hard, you will damage the gum tissue and the enamel below it. Soft pressure, consistent angles, and 2 full minutes. Care 2 is flossing. The step that saves your teeth and your heart, and this is the one most people admit to skipping. When you don't floss, you leave plaque between your teeth that your toothbrush can't reach. That plaque calcifies into tartar within 24 to 72 hours. Tartar causes gum disease. And gum disease, when untreated, doesn't just destroy the bone that holds your teeth in place. Harvard Medical School research links periodontal disease to a significantly higher risk of heart disease, stroke, and diabetes. Bacteria from inflamed gums can enter the bloodstream and contribute to the buildup of arterial plaque, increasing the risk of heart attack and stroke. Floss once every day. Guide it gently between each tooth. Curve it around the base of each tooth in a C shape and slide it up and down under the gum line. It takes 2 minutes. Mention in the comments if you're having trouble flossing. Care 3 is using a fluoride toothpaste, as fluoride is one ingredient that remineralizes enamel. Use a toothpaste with fluoride specifically. Here is what it does that nothing else can. Enamel, which is the hard outer layer of your tooth, cannot regenerate once it's gone, but it can remineralize in its early stages of decay. Fluoride accelerates that remineralization. A Cochrane systematic review confirmed that water fluoridation and fluoride toothpaste are among the most evidence-based dental interventions available. Use a pea-sized amount. And here is something almost nobody does. After brushing, spit, but don't rinse immediately. Let the fluoride sit on your teeth for 5 to 10 minutes. Rinsing immediately washes away the protective film you just applied. This is one habit change with measurable enamel protection benefit. Starting tonight. Care 4 is using an antiseptic mouthwash, which is the third line of defense most people skip. Antiseptic mouthwash is used after flossing and brushing. Antiseptic mouthwash reaches the surfaces and gaps your brush and floss couldn't. It reduces the total bacterial load in your mouth by up to 75%. Look for a mouthwash containing chlorhexidine or acetylpyridinium chloride, as both are clinically proven to reduce gingivitis and plaque. Use it for 30 full seconds, swishing actively around all surfaces. Do not eat or drink for 30 minutes after. The ADA recommends using mouthwash as a complement and not a replacement for brushing and flossing. Together, the three create a layered defense that dramatically reduces your risk of cavities, gum disease, and bad breath. Use it at night before bed when bacterial activity is highest. Care 5 is tongue cleaning, an often overlooked habit that transforms oral hygiene. The tongue is a textured surface with hundreds of tiny papillae crevices where bacteria, dead cells, and food debris accumulate. This is where approximately 80 to 90% of bad breath originates. But the impact goes beyond breath, as the bacteria on an uncleaned tongue transfer directly back onto your teeth and gums every time you close your mouth. Use a tongue scraper and not your toothbrush. Scrape from back to front 5 to 7 times. A tongue scraper removes 30% more bacteria from the tongue surface than a toothbrush. A 2025 systematic review in the National Library of Medicine confirmed that plant-based and mechanical tongue cleaning both significantly reduce oral bacterial load and improve gum health outcomes. 1 minute, every morning, and your mouth will feel different within 3 days. Mention in the comments if you are having trouble cleaning your tongue. Care 6 is having a healthy diet, as what you eat directly determines how long your teeth last. Sugar is the primary fuel source for the bacteria that produce the acid that destroys enamel. Every time you consume sugar, those bacteria produce acid that attacks your enamel for 20 minutes. 3 sugary snacks in a day means your enamel is under acid attack for an hour. Acidic drinks like sodas, citrus juices, sports drinks, and kombucha erode enamel directly, even without bacteria. Medline Plus recommends avoiding sweets and sweetened drinks specifically as a dental care measure, and brushing soon after consuming them if you do. But here is the critical nuance. Do not brush immediately after an acidic drink. Wait for 30 minutes. Acid temporarily weakens enamel, and brushing on weakened enamel increases abrasive damage. Wait a while, then brush. Saliva is your mouth's natural defense mechanism. Staying hydrated keeps saliva production high. Care 7 is hydration, as saliva is your mouth's 24/7 defense system. Saliva is not just moisture, it is a complex biological fluid that contains antimicrobial proteins, neutralizes acid, washes away food debris, and delivers calcium and phosphate to remineralize enamel. Dry mouth, which occurs with dehydration, many medications, and mouth breathing, removes this entire defense system. Dry mouth dramatically increases your risk of cavities, gum disease, and bad breath. Drink water consistently throughout the day, at least 8 glasses. Choose water over tea, coffee, and sodas as your primary hydration. Care 8 is night guards and regular checkups. These are the 2 related but distinct habits. Teeth grinding, called bruxism, affects an estimated 1 in 3 people, and most of them don't know they're doing it because it happens during sleep. Bruxism wears down enamel, cracks teeth, causes jaw pain, and can destroy dental work worth thousands in a matter of months. Colgate's dental guidance confirms that if grinding or clenching is causing pain, a mouth guard is the recommended intervention. A custom night guard from your dentist costs a fraction of the tooth repair it prevents. And regular dental checkups every 6 months allow your dentist to identify cavities, gum disease, and early signs of oral cancer before they require expensive, painful, or irreversible treatment. Prevention costs pennies. Treatment costs thousands. Choose prevention. Next, we're coming up to the part that surprises most people. The 4 pain remedies you can do right now for tooth pain, and I've ranked them from the ones that kick in fastest to the ones that last longest. Remedy 1 is the cold compress that numbs pain and reduces swelling in under 10 minutes. This is your fastest acting option. Wrap an ice pack or ice bag in a thin cloth or towel. Apply to the outer cheek over the affected tooth. Hold for 10 minutes. Remove for 10 minutes. Repeat the above for up to an hour. Cold constricts blood vessels, which reduces inflammation and numbs the nerve endings near the surface. You should feel meaningful relief within 5 to 10 minutes. Never apply ice directly to the skin or tooth, as it can cause cold burns and nerve hypersensitivity. Always wrap it first. Mention in the comments if you are facing a problem with cold press. Remedy 2 is a saltwater rinse, as it disinfects, reduces inflammation, and loosens debris. This is your most versatile, most available, and most evidence-backed home remedy. Healthline's April 2025 dental guide confirms that a saltwater rinse is a natural disinfectant that can loosen food particles and debris stuck between teeth, reduce inflammation, and provide temporary pain relief. Take half a teaspoon of table salt and 1 glass of warm water. Stir until dissolved. Swish for 30 seconds around the affected area. Spit. Repeat every 2 to 3 hours. Effective for pain, inflammation, and clearing food debris from infected areas. Remedy 3 is clove oil, which is nature's most powerful dental anesthetic. Clove oil contains eugenol, a natural compound that works as both a local anesthetic and an antimicrobial agent. Apply 1 to 2 drops to a cotton ball and hold it gently against the painful tooth and gum for 2 to 3 minutes. You should feel numbness begin within a minute. Do not apply undiluted clove oil directly to the gum with your finger, as it can cause chemical irritation. Remedy 4 is using a turmeric paste, the anti-inflammatory that outlasts most topical treatments. Mix half a teaspoon of turmeric powder with a few drops of water or coconut oil to make a paste. Apply directly to the painful area with a cotton ball or clean finger. Hold for 5 minutes, then rinse. Turmeric contains curcumin, which is one of the most extensively studied natural anti-inflammatory compounds in biomedical science. Mention in comments if you are facing a problem with turmeric paste. Here is what I want you to take from this. Your mouth is not separate from your body. Every choice you make about your dental hygiene, every brush, every floss, every glass of water sends a message to your heart, your brain, and your immune system. And every choice you avoid sends a different message. Make your mouth the healthiest part of your body starting tonight. Drop in the comments. Which of these 8 care habits are you adding to your routine, and which one surprised you most? If this helped you or someone you love, please share it. A healthy mouth is worth 2 minutes of your evening. See you in the next one.